Hello and namaste. A warm welcome to the COVID Care series presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram. We at Apollo send our best wishes to you all to stay safe and healthy during this challenging time of the COVID-19 pandemic. Do follow all precautions and do not believe hearsay and unfounded facts that are circulating on social media. We also bring you relevant, authentic, and detailed information every single day, not just about COVID-19 in general, but every aspect of our life and health that COVID-19 affects. An important aspect of a healthy lifestyle at all times, but especially during this time, is fitness and exercise. But most people who get COVID-19 infection feel so exhausted and fatigued, and many of them also suffer from body aches and pains. Exercise is often the last thing on their mind. But it is established that even COVID-19 patients who are recovering must start some sort of mild activity and progress gradually, as we now know that exercise helps recovery and lightens the low and depressed mood that sometimes people have when they're isolated and recovering. And as for those of us who are in quarantine or lockdowns, we can't go to gyms or walk in the park, but we need to improvise and work on some fitness activity, as a fit body builds immunity and also gives us that feel-good effect. Exercises to improve the lung capacity is another area that we need to work on, as it may help COVID patients recover faster from the lung damage that the disease might cause. So today we are going to talk about all of this in our COVID Care series, and this is going to be presented by Dr. Richa Sharma. Dr. Richa Sharma is a physiotherapist from Apollo Hospitals, Noida, and she has a rich experience of over 11 years of working in several super specialty hospitals and rehabilitation centers. She has a master's in physiotherapy, and her area of expertise includes musculoskeletal, manual therapies, and sports injuries. She's professionally trained and certified in therapy and techniques like myofascial release, positional release technique, rehab of the various joints, as well as antenatal and postnatal exercises, and was also appointed as official physiotherapist to the International Women's Golf Championship held in Bangalore. Hello, Dr. Sharma. Thank you for being with us today, and a warm welcome to our COVID Care series. We will begin with a short description from you about what people can do to bounce back to fitness after COVID-19. And after some time, we will also take some questions, both some which I have from what people are looking for and searching for, and we'll also get some questions real time from our FB Live audience. Over to you now.
Thanks, Dr. Srinidhi, for your kind words. So today we'll be discussing about how to bounce back to fitness post-COVID-19 recovery. So let me begin with a quote that health is an investment, not an expense. So you might have tested negative, but the post-COVID recovery symptoms may linger on for a little while. And the common symptoms which we are experiencing, which we are facing, the patients are complaining, is severe fatigue, a lot of shortness of breath, and severe muscle pains and the joint stiffness. So in turn makes an individual very difficult to carry out his or her activities of daily living. So thereby, this in turn leads to the stress and anxiety and can have a negative impact on a person's mind. So to overcome this, the solution is exercise. The solution is movement, because exercise not only helps in regaining your confidence by improving the strength and by increasing the endurance, but it also releases some feel-good hormones which are called the serotonin. So when you exercise, the serotonin, it releases from the brain, and thereby the person starts feeling it's a mood elevator, and the level of the stress and the anxiety, it gets decreased. So it's very important for all of you to have a physical assessment And exercise helps in the recovery as well as in the healing process. So to discuss this, we'll be a little bit focusing about the three major fitness systems. Those are pulmonary, cardiovascular, musculoskeletal, and a little bit about the immunological fitness. Once I have done with this, then we'll be moving to what is the right time and what is the right form of the exercise regimen. And especially, we will categorize according to the symptoms of the individual, and we'll be sharing something with you also for the general well-being. So to begin with, let me just introduce about the pulmonary fitness. As you all know, that our lung is just like a balloon. So when you take a deep breath in, the lung, it inflates, and when you breathe out, the lung, it deflates. Imagine if there is any constriction in some part of the lung, as what happens in coronavirus, because it primarily impacts our lung. So some segments of the lungs, it can lead to the fibrosis or scarring where the proper oxygenation consumption doesn't take place. So to overcome this, we definitely have to strengthen our pulmonary fitness with the help of corrective and timely doing respiratory exercises, lung capacity exercises. The second system is musculoskeletal fitness system. Now, because of the prolonged stay in the hospital or those individuals who are quarantined or at home isolation, definitely they are immobile. And because of the inactivity, it leads to the decrease in the strength and the endurance of the individual also get diminished. So not only that, because of the prolonged usage of corticosteroids or immunosuppressants, individual starts getting weakness of the muscle also. So to combat this, definitely you need to do specific slow intensity strengthening exercises, flexibility exercises to improve the joint stiffness. And definitely in that way, you can get rid of severe muscular pain and the joint stiffness. The third system, fitness system, will be talking about the cardiovascular. So in short, I just want to make you in a very simple way that the heart muscle requires oxygen to pump out the blood to all, and it circulates to all the body organs through the circulatory system. So when the coronavirus, it impacts our lung primarily, indirectly it causes effect on our lung also, because the proper or the optimum level of the oxygen doesn't reaches to the heart. So because of that, the heart muscle has to work harder and harder, and thereby it can lead to the muscle injury of the heart muscle as well. Not only that, when the coronavirus attacks in certain individuals, we have seen that it leads to the virus causes the inflammation, and our body's own immunity system signals get disturbed, and it starts fighting against the healthy tissues itself, and it starts damaging the blood capillaries, the vessels, which ultimately leads to thrombosis, which is nothing but a small clot which blocks the circulation, and that's why a person can lead to heart attack as well. And finally, little bit about the immunological fitness. Definitely, you need to improve your fitness to fight against the virus, which you can achieve by including a protein diet, and you have to stay hydrated, eat well, you need to sleep well, and enough of rest is required. Now, the question comes when to start with the exercise and how to proceed. What is the correct form of the exercise? That's why the people are very confused. So, even though you have tested negative, but a lot of physical COVID-19 impairments which we are seeing among the patients, and that's why the patient starts losing confidence. So according to the HSS, that is the Hospital for the Special Surgery Sports Medicine Institute of New York, they have published recently certain guidelines how to bring back the individual and how to categorize them, when to start with the right form of the exercise. So let me just explain you in a simple words. Those individuals who are asymptomatic, or those individuals where lung has not been impacted, for the mild symptoms individual, once they are tested negative, they can start with the mild form of slow intensity exercise, such as walking, sport marching, at least for 5 to 10 minutes in a day, some form of gentle warm-up exercises. And from second week onwards, they can double the pace with the numbers of repetitions. Even those individuals, they can start with the weight training exercises also from the third week onwards. So I'm focusing more on to start gradual. That is very, very important to understand. Why? Because there are certain kind of protein which is called as cytokinin proteins. These are the large group of the protein which is released or secreted from the immunity system and which regulates the inflammation and the immunity. So if you start in the beginning with the moderate intensity or the high intensity exercises, it can lead to cytokinin storm, which is you must be aware of. So you should not do any kinds of exercises that pace up your heartbeat randomly. So those individuals, now the second group of people are those individuals where the coronavirus has actually impacted their lung. Those individuals who are having respiratory disorders such as asthma, pneumonia, those individuals definitely have to wait for a period of at least 2 to 3 weeks. Once their symptoms stops, they can start with the slow breathing exercises, lung capacity exercises, but make sure to monitor your respiratory rate and oxygen saturation level with the help of pulse oximeter. Now, the third group of individuals are those individuals who are already having chronic cardiac ailments. They have to certainly wait at least for a period of 4 to 6 weeks, and definitely after that, they have to start with the cardio exercises, warm-up exercises, deconditioning exercises. In that way, they are going to be healthy. Now, before those individuals who have recently met with a heart attack or inflammation of the heart muscle, which we call as and myocarditis, those individuals, they definitely have to wait at least a period of 3 to 6 months. And before jumping out to their exercise regimen, it is advisable to seek their cardiologist advice, and then only they should start with the exercise. Now, it's a small note. I just want to say that those individuals who are on blood thinners, definitely those individuals have to start a bit early, because as you know that the early movement it's a form of simple walking. It helps in the prevention of clot formation. And that is why exercise plays a very pivotal role over here. So after this, I just wanted to share some video and in the form of breathing exercises and some general well-being exercises, which includes warm-up and cool-down exercises, a little bit about the strengthening exercises, the spinal strengthening exercises. And these exercises should be, these are just the well-being exercises, mind you, and this is recommended by WHO. Now, this is my, humble request to all the individuals that not two individuals having the same symptoms will have the same amount of the recovery. So exercise is tailor-made exercise. It has to undergo with the proper physical assessment according to the individual needs and demands. And the exercises which I'm sharing are the general well-being exercises. Just have a look.
So first we'll be focusing on breathing exercise. The importance of breathing exercise is that it helps in airway clearance, it improves oxygen consumption. Not only that, it helps in relaxation also. So first is the diaphragmatic or the belly breathing exercise. As you all know that the diaphragm is the primary muscle of the respiration. So in individuals, those who are suffering from chronic obstructive pulmonary disease such as asthma, pneumonia, so in those individuals, when they exhale the air out, it loses some of the elasticity of the lung. So it doesn't go back to its original position, and thereby some amounts of the air, it enters into the lung. So when you strengthen the diaphragm, it helps in pulling out of the air, and thereby it helps in giving the maximum ventilation to all the parts of the lung. So the first is diaphragmatic or the belly breathing exercise. For that, you can start even in sitting or lying down position. So for this, the patient should be in lying down position. Knees, definitely you need to bend it, and arm should be at the side of your body. One hand, you need to just keep it on above the chest, and one hand, it should be on the belly. Now this exercise, you have to repeat at least for 3 to 5 repetitions. And definitely you need to take a deep breath in through your nose, and you need to breathe out slowly through your mouth. So we'll begin with, so take a deep breath in through your nose, and while inhalation you can see the belly will rise, and slowly you need to breathe out through your mouth. Now it's very important that placing of the hand, it gives you a feedback where you can feel the movement of the belly, that it is rising during inhalation, and the tummy, it is going down while exhalation. So shall we do once again? Take a deep breath in through your nose. You can see the tummy is rising, and breathe out slowly through your mouth where you can see the belly is going down. One more time. The second group of exercise is segmental breathing exercises. Before that, I'm just would like to give a brief up about segmental breathing exercise. You must know that the air is lighter, and our lung is having different segments just like a ball. So the upper segments of the lung, it is well nourished with the oxygen, but some segments of the lungs in the lower portions, definitely they are not well nourished with the oxygen. Thus, when a person who are having respiratory disorders, and when the coronavirus, it damages the lung, definitely it can lead to some segments of the lung get fibrosed, and it leads to scarring of the lung as well. So by doing the segmental breathing exercises, we are initiating, or we are facilitating maximum oxygenation or ventilation to all the segments of the lung. So to begin with, you have to be in sitting position, and for that you need one towel, or you can use a bedsheet roll or a strap or a muffler. So to begin with, the person should be in starting in now in sitting position, to the chest, to all the segments of the lung. Take a breath out through your nose. All right. So first, breathe out. While breathing out, make sure that you are applying a little resistance towards the chest wall, such that the chest wall, you can see it is going in, and slowly breathe out through your nose. We'll repeat once again. Take a breathe out through your mouth slowly, apply a little stretch towards the chest wall, and slowly breathe in through your nose. So you can feel very well the chest is going in while exhalation, and the lungs is moving out during inhalation. So it improves the maximum ventilation to all the segments of the lung. The same thing you have to repeat, and you can place the towel roll under the armpit. This will facilitate the middle segments of the lung. The same way, cross the towel place in front of the chest and breathe out slowly through your mouth and give a little stretch to the chest and breathe in slowly. Apply a little stretch. The chest wall is going in and breathe in through your nose. You can say that the lung is inflating. Now the third one for the upper or the front part of the chest, for that you don't have to use a towel or a bedsheet roll. You can use your own hand and you can just place it on the front part of the chest, and with the help of the fingers you need to apply a minimal resistance while exhalation. Breathe out slowly through your mouth. Apply a little pressure from your fingers and you can place the hand, this is for your information, just place your hand under the collarbone. This is for the front part of the chest. So exhalation, take a deep breath out through your mouth, apply a little force from your finger and take a deep breath in. Again, breathe out through your nose very slowly, apply a little pressure and take a deep breath in through your nose. Now thirdly, we'll be focusing on respiratometer. In simple words, you need to understand that this respiratometer is the dumbbell of the lung. So for that, you need to place one hand over the mouthpiece, another one you just have to hold the base of the spirometer. You need to breathe in. While inhalation, you can see that 3-colored ball and the 3-colored ball are having different lung volumes. So the primary function of the respiratometer is that it helps in improving the capacity of the lung, which get diminished when our lung get damaged because of the coronavirus. Some segments of the lungs or because of the scarring, it leads to the fibrosis. So the oxygen consumption here decreases and the person starts getting shortness of the breath. So this respiratometer is primarily will be focusing on increasing the strength of the respiratory muscle as well as it increase the lung capacity as well. Relax. Now, it's very important for all of you to understand when you're taking a deep breath in, the ball should go up. And as if you just have to imagine as if you are drinking coconut water, you are taking any fluid from the pipe. So it's very important that you have to give a rest in between your exercise, because if you are doing this exercise and without any rest, it can lead to the fatigue and there can be shortness of the breath. So it's essential to give a rest in between, and this you can repeat for 5 to 10 repetitions at one set. And to be done in a day, you should do at least 4 to 5 times. Sir? So before starting with your workout, it is essential to carry out warm-up exercise. The importance of warm-up exercise is that it increases the blood flow to different parts of the muscles. Not only that, the amount of the soreness, which we call as DOMS, which you experience after the workout, it helps in delaying or it helps in minimizing even muscle soreness also. So to begin with, let's start with the warm-up exercises. And warm-up exercise should be done at least for 3 to 5 repetitions at one set. So the first one is ankle circle. Here, you need to move the ankle in clockwise 5 times and then anti-clockwise direction again in 5 times. Now move your ankle up and down. Similarly for the other foot also. If any individual is facing difficulty in carrying out exercise in standing, you can stretch your ankle, or you can do this ankle toe movements in lying position as well. Now the second exercise is spot marching. So gently just move your leg on a same place. The third exercise is spinal twist. Be in a standing position without changing your body direction. You just have to slowly twist your spine right direction as well as in the left side. The next exercise comes as shoulder rise. Again, at least for 5 repetitions. Moving to the further exercise comes as shoulder circle. Now the shoulder circle, it's very important exercise because of the prolonged immobilization which we can see. The patient gets a lot of stiffness in the neck as well as shoulder muscles. So moving the shoulder up front, then taking it back and comes in downward direction, thus completing a full circle. So you need to move your shoulders, do shoulder circling clockwise, 5 repetitions, as well as you need to move in anti-clockwise direction. So it helps in the relaxation of shoulder muscles. So the next exercise is sitting to standing, where you can see that you have to use one chair, and then you slowly, from sitting, you slowly have to stand. Again, go back and slowly stand. Now, in case you have difficulty in getting up, you can always hold your hand or clasp your hand, rock in the front and back directions, and then you can get up. So this helps in reinforcement. So the hand, yes, and again go back, rock for some time. Very good. 2-3 times and then get up. So the next exercise is wall push-up. So you have to stand in front of the wall, and by placing your hand, you need to go forward towards the wall, lean towards the wall, and you can just see the leg position, that you can just stand in a step standing position for the support. Go towards the wall, elbow should be bent, and then come back by making your elbow straight. Again, go back. Very good. One more time. Now we'll be showing some of the basic spinal strengthening exercise, and this you need to repeat for at least for 3 to 5 repetitions initially. Make sure that you're going slow in the initial phase of the workout. So the first one is leg raise. One by one, slowly down. Same thing you need to repeat for the other leg as well. The second exercise is called as bridging exercise. For that, you have to fold your knees. Arms should be at the side of your body. Now join your feet together. And by pressing the feet down, you can see raising of the hip up in the air. It's very important to clear from the bed. And then slowly moving down. We'll repeat once again. The next exercise is head press exercise. For that, the position is gonna be the same. That means you need to keep your knees, because this is a very optimal position for carrying out some of your back exercises, because the lower portion of the curve which is present in the lower spine, it gets obliterated. So in this position, arm should be at the side of your body. You need to fold your legs and press your head down to the pillow. Slowly relax. Again, press your head down to the pillow. Hold for 5 seconds. 1, 2, 3, 4, 5. Slowly relax. You are not supposed to hold your breath in any of the exercises. In and out of the air should be normal. So rather you can just count also while doing the exercises slowly. So some of the spinal strengthening exercises you have to do in belly lying down positions if you are comfortable. Now to begin with, first it should be leg straight, one by one. Definitely raise your one leg at a time with knees straight. Hold for 3 to 5 seconds. 1, 2, 3, 4, 5. Slowly move it down. Similarly for the other leg as well. Knee should be straight. 1, 2, 3, 4, 5. Relax. Again. One more time. The next group is the same. You need not to change your position. Just come on your elbows and look towards the chin. That's very important for you to strengthen the paraspinal muscle. 1, 2, 3, 4, 5. And slowly bring your head down. Again, lift your chin up. Now hold here for 1, 2, 3, 4, 5. Bring it down. One more time. Chin lift, look towards the ceiling and hold here for 1, 2, 3, 4, 5 and slowly bring it down. Now the next progression will be moving for all 4 exercise. Quadruped position, you need to take it. Just legs be back. So the entire, make sure your elbow should be straight. Now in this exercise, you need to make a hump at a time, and the second time you need to make a hunch by making an appropriate arch, which we are going to show you. This is one of the most effective core strengthening exercise. So make a hump by moving the mid part of the chest, and elbow should be straight. Hold here 1, 2, 3, 4, 5 and next goes and make an arch, and you can see very beautifully, you can see an arch, and hold here for again 1, 2, 3, 4, 5. Let's do it once again. Make a hump. 1, 2, 3, 4, 5. Relax. Make a hunch. 1, 2, 3, 4, 5. Come back. So once you have finished with your exercise regimen, it's very important again to do some cool down exercises. The importance of cool down exercises is that it allows the gradual recovery of your pre-exercise heart rate as well as the blood pressure rate. So it's very important to do these exercises, cool down exercises, which are nothing but the most of the stretching exercises. So first we begin with ankle, that is calf stretch. For that you can use any table. A small raise is required. Place one foot and just lean your body, just rise it and give pressure over the foot. You're gonna get a lot of stretching at the back of your calf muscle. Over here you're going to feel the stretch. Now hold this stretching period at least for 10 to 30 seconds and go for 2 to 3 repetitions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Do it for the other calf muscle. Give pressure. Very good. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now the next stretch is hamstring stretching. Slowly, back should be straight and slowly go down. You're gonna feel a very effective stretch at the back of your thigh, and this is called as this position, and this is very effective for hamstring stretching. Hold again here for 10 to 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax slowly. Do for the other leg as well. Leg should be straight, back should be straight and slightly bend down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The next exercise is the quadricep stretch, which is present in front of your thigh, the front of the thigh muscle. We're going to do the stretching exercise. For that, you just have to bend your knee back in standing position and hold here for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And the same thing you need to repeat for the other leg also. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. The next exercise is the tricep stretch. For that, you just have one side of the arm, you just have to bend it, and with the other hand, you just have to stretch it out. Hold here for 10 to 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you're going to feel the stretch at the back of your arm. So this is you can say that upper arm stretching exercise, and same repeat with the other arm also. Without changing or without twisting your body, the body should be straight. Only you just have to stretch at the back of your arm. Hold it here for 10 to 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Go again for 3 repetition minimum. You can go for 3 to 5 repetitions each of the stretching exercises, which with 10 to 30 seconds of hold time. Serious actually ho raha hai. All right. So I just want to conclude that these are the set of exercises. These are the general well-being exercises which is recommended by WHO. Now, in case any individuals who are having any difficulty while carrying out their exercises, in case you develop shortness of the breath, which is unusual than the normal and which is not settling down even at rest also or by changing position, if you develop any kind of chest pain, if you develop palpitation, lots of heartbeats, definitely you need to go for medical intervention is required. Seek medical advice as soon as possible.
Thank you, Dr. Richa. That was like a really elaborate, and I'm sure our viewers found it also very useful because they can just play this and follow it, and they can do the right kind of warm up, exercise, and cool down. We will now come to a couple of questions before we wind up the section. So, how long should supposing somebody is just in quarantine or asymptomatic? What should they do when they're feeling quite well? Is it okay for them to do their whatever exercise they used to? What can they do within a confined space?
Dr. Sridevi, if you can a bit louder, it will be easy.
Yeah, I just wanted to know.
Yeah.
You hear me now?
Yes, of course.
What kind of exercise could a person who is in a quarantine or in an isolation with asymptomatic COVID perhaps, now they're feeling quite well, but they don't have enough space. They have to remain inside their room. So what kind of exercises could they do, or should they, what is it advisable to do it if there is a suspected COVID which is asymptomatic?
Yes. If the individual is asymptomatic, then definitely once they are tested negative, they can start with the exercises in the first week onwards. They can go for walking, say that 5 to 10 minutes, gentle warm-up exercises, stretching exercises, which these are the exercises which are nothing but the deworming exercises. Because in the isolations, when you're at home isolation with the constricted space, definitely you don't have more scope to do lot many exercises, but you can do these exercises in the initial first week, certainly, and you can collaborate lot of pranayama exercises because that helps in relaxations of the mind as well as the body. Not only that, from second week onwards, you can increase this exercise with the numbers of repetitions. You can go for spot marching, light jogging. You can do even jumping jacks also. If you don't get symptoms, you can do all these exercises along with the yoga and pranayama. And you can even go for even weight training exercises with the help of the dumbbells, which is now youngsters are using very readily at home. So from the third week onwards, definitely I would recommend they can start with the weight training exercises if they don't have any symptoms. Because weight training exercises or the resistance exercises are the best form of the strengthening exercises, and it enhances the bone density also. So they can go ahead like that.
If a person has just tested negative, how long could they wait before they resume their existing whatever physical activity that they were doing earlier?
Yes, certainly they have to wait. If they had tested negative, then also they have to wait to bring back to their pre-exercise regimen, because as I have already explained that you never know when this cytokine storm will come and it start causing the inflammation of the virus. It starts producing, which generally develops after 5 to 7 days of the infection only. So you never know when it might can get exacerbated. So the individual, even though they are asymptomatic, definitely they have to go slow, they have to go gradual with the exercises.
So that again brings us to what kind of, how should they start slow? Of course, you have given us the detailed plan now. What about, so if they're doing yoga, so can they, is Surya Namaskar considered or all the asanas considered mild, or they have to wait a while for that as well?
Dr. Srinidhi, they can go even the yoga and the asanas. They can go definitely if they're asymptomatic, and they can definitely go with the lesser repetitions initially.
So I guess we need to take it slowly and see how they feel. I suppose they are the best judge of
exactly,
what exactly they can do at any point in time. The other question is for people who don't have COVID, but they are at home during a lockdown, or they may be under some kind of a home quarantine because somebody else has tested positive in the house. So in these kind of situations, also it is difficult for people to exercise. So what can be, and they can't go to the gyms or parks or pools. So what can they do within maybe say a terrace or a compound without also endangering their COVID safety?
Okay. Yes, even though they don't have COVID, but the individuals who are, restricted at home, it has a very bad effect on a person's mind. Rather, we can say that it has a negative impact, and that leads to a person into stress, and sometimes they leads to depression also. And certain individuals, you can say, they are very enthusiastic. They want to go back to their workout regimen, but they are unable to do because the gyms are closed. So certainly you have to, tailor make your exercise, and even at your terrace, you can go for walking, you can go for brisk walking, and you can go for a lot of relaxations and the yoga, asanas, pranayam exercise. You can go for spot marching, spot jogging, mild jogging, and you can do lots of stretching exercises. So that definitely it elevates your mood. I hope a lot of serotonin will release and the person starts feeling elated, and they can later on they can go with the weight training exercises with the help of the dumbbells and the sandbags. So this really helps in improving a person health as well as mind.
We will just take a few questions from our viewers real time now. So one is, I was admitted in hospital for pneumonia, COVID pneumonia for 10 days. I get body aches and headache if I do yoga. Please advise.
Okay. The individual was having pneumonia.
Yeah, for 10 days. And I assume
Okay.
that they are now back home and trying to start a yoga routine.
Okay. The individual was having difficulty in carrying out yoga. Okay. So definitely not to worry. See, the individuals, you first have to understand that pneumonia definitely it impacts all the segments of the lung, and especially with having a lot of patches, the person feels decrease in the oxygen consumption, and the person gets a lot of fatigue. So that's why, and while doing the exercises, they get a lot of shortness of the breath also. So first, you have to listen to your body. That is very, very essential for them. And the individuals who are having pneumonia, even
Sorry, viewers, I think there's been a bit of a network disruption. So we've had a very detailed and very elaborate session with Dr. Richa Sharma. So I do hope that you found all the practical demonstration very useful, and you will practice these, and they would provide a basic plan for you to resume your warm-up, your minimal exercises, and the cool down. If you have more queries, you can reach out to us at on our Facebook page, either on our comments or on inbox in Facebook Messenger. Tomorrow, we're going to be discussing COVID-19 and chronic respiratory illness. This is going to be discussed by Dr. Shailesh Agarwal from Indore, Apollo Hospitals, Indore. Meanwhile, now till we meet tomorrow, I hope that you haven't forgotten SMS, which is social distancing, wearing a mask, and sanitizing. Stay safe, stay healthy, and see you tomorrow. Namaste.